Well, we see it, we watch it, we feel it, talking about our vets battling depression, thoughts of suicide, traumatic brain injuries, and physical wounds. So why on earth would Defense Secretary Robert Gates actually want to slash their health care? Veterans groups are up in arms, but Gates says before you jump to conclusions and judge him, consider the almighty dollar. He says, quote, leaving aside the sacred obligation we have to America's wounded warriors, health care costs are eating the Defense Department alive. The program is called Tricare. Here's where it stands right now. 10 million people are eligible, and the cost has exploded. The price tag more than doubled to $50 billion in the past decade. The plan's short on specifics, but we know this much. Fees would go up for military retirees under 65, but rates for older retirees would stay the same. And health care for active duty troops, still free. And Gates says it could save up to $7 billion over the next 5 years. Paul Rieckhoff is the founder and executive director for Iraq and Afghanistan, Veterans of America. Paul, the defense chief has tried to do this before, but it never really got anywhere. So what do you think makes this announcement so different?
Well, times are obviously tougher in America and definitely in Washington, but that's no reason to start nickel and diming our veterans coming home from Iraq and Afghanistan. Those retirees under 65 are largely folks who served in Iraq and Afghanistan. Over 2 million folks have served through Iraq and Afghanistan since 9/11. About 500,000 have been there more than once, and they're coming home to this toughest economic situation in decades. Unemployment for those veterans is over 11%. So we understand times are tough in Washington, but our troops are not going to be the place for you to balance your budget or find cost savings. They've got to look elsewhere.
So if this does pass, how do you think it's going to impact the troops immediately? What will we see right off the bat?
Well, it means more money out of pocket for those folks who just left the Army or the Navy or another service, and they're trying to transition into a civilian life or go back to school, and they've got families, and they're trying to make ends meet. So if their health care costs are going to go up, it's going to impact them dramatically. But I don't think this is going to go forward, Kira. This has been tried in the past. All the veterans groups in America are going to be united in opposition to this. IAVA stands strongly against these fee increases, and we hope the Department of Defense will look for other areas to cut. There's plenty of inefficiencies. There's plenty of bloated contracts. They can go find other places that don't impact our personnel that we need most, and they really consider this part of their benefit. You know, health care after you get out of the military, education after you get out of the military, that's part of the deal. So we've got to hold up our end of that deal and make sure they're taken care of.
Well, we're definitely going to see cuts. I was talking to a high-level general just a couple weeks ago, and he was talking about these high-level meetings they were having and how stressful it is to see what's ahead and how it's going to completely impact all branches of the military. So let me ask you about the health care. If we don't see the cuts there, Paul, where do you trim the fat?
Well, you know, first of all, that's the challenge for Congress, right? And that's what's going to happen now is this budget's going to go to Congress, and I think you're going to find, you know, most of the House is not going to go near this. They know that veterans groups are going to be extremely vocal. They know the American people will be behind us, and this will kind of be a political third rail. So I think once it hits the debate in Congress, we're going to see that really slow down. But there's plenty of places in a budget that is so enormous for us to cut costs. We know there's tremendous inefficiencies. There are major weapon programs. There's lots of places where they can cut, but it shouldn't be on that young sergeant or that young captain coming back from the military and trying to transition to civilian life, trying to take care of their family and move on. We're talking about health care here for folks who've served over and over again in wars that have gone on for almost 10 years. So you can't really try to achieve parity between the military and the civilian life if you think about how much our military's done over the last couple of years.
And you're talking about wars that have completely devastated so many military families as these guys and women come home and have to deal with these injuries that are just pretty much unfathomable. Paul Rieckhoff, it's always great to have you weigh in. Always appreciate your time and seeing you. Thanks so much.
Thank you, Kara. I appreciate it.
You bet.